Hello and welcome to today's webinar, The Impact of HPV Vaccinations, Oral Health at the Center. My name is Ashley Herman and I am the Community Outreach and Project Development Director with the Missouri Coalition for Oral Health, and I'll be serving as your facilitator for today's webinar. The Missouri Coalition for Oral Health is a 501c3 advocacy organization focused on policy and systems change to increase access to oral health services for all Missourians. Over the years, the coalition has achieved multiple successes, including the reinstatement of adult dental benefits in Missouri Medicaid in 2016, and most recently, a rate increase for Medicaid dental benefits effective in July 2022. This substantial increase helped to increase reimbursement rates to those near commercial levels in Missouri. To learn more about the coalition, you can visit our website, our Facebook page, Twitter, and LinkedIn. At the conclusion of today's webinar, you'll receive a survey to complete in order to obtain your continuing education credits. Today's webinar is being recorded and the recording will be made available on our website at a later time. With this being a webinar format, all attendees are in listen-only mode and questions can be submitted via the chat or the Q&A box, both located at the bottom of your Zoom window. With that, I would like to introduce our speaker for today, Dr. Jacqueline Miller. Dr. Miller is a diplomat of the American Board of Orthodontics and a fellow of the International College of Dentists and the American College of Dentists. She is a member of the Southwest County Dental Society, the Missouri Society of Orthodontists, Midwestern Society of Orthodontists, American Association of Orthodontists, and the Washington University Orthodontic Study Club. Dr. Miller served 11 years in the Midwestern Society of Orthodontics, culminating in serving as the first female president of the Midwestern Society of Orthodontists in 2011. Dr. Miller serves on the Missouri Coalition for Oral Health Board of Directors, representing the state of Missouri, and she is the current dental director for the state of Missouri. Dr. Miller, with that, I'll turn the floor over to you.
Oh, thank you very much, Ashley. And just a real quick thing, I can't see the questions, so feel free to stop me at any time if there are questions in the chat bar. Good afternoon, and thank you so much for taking time out of your busy week to join us here for our presentation entitled The Impact of HPV Vaccinations, Oral Health at the Center. I'd like to take a moment to thank the Missouri Coalition of Oral Health for sponsoring this webinar. Today, we will be discussing a novel approach utilizing all dental professionals, including dentists, dental hygienists, dental assistants, and dental front office personnel to work together to increase Missouri's human papilloma virus rates, vaccination rates. Before I get started, I would just like to take a moment to remind everybody about the upcoming presentation, the MCOH Oral Health Policy Conference. This is 2 days of outstanding presentations. You even have the opportunity to visit the Capitol as part of the Legislative Access and Awareness event, hoping we can see everyone attend this most important program. Okay, I just wanted to start a little bit with letting you know who I am. I am your dental director. I'm the Missouri State Dental Director at the Office of Dental Health. We are underneath DHSS, the Department of Health and Senior Services. Our office is committed to improving the oral health of all Missourians through education, prevention, and leadership. This is a picture of our amazing core team, along with our fantastic 5 oral health consultants. Let me just start with a little background about myself. I am a retired orthodontist. I worked for 29 years in the areas of Washington, Sullivan, and Eureka, Missouri. So you might be wondering, why is a retired orthodontist speaking on HPV vaccination? Well, my history involves quite a bit of volunteer dentistry, both here in Missouri and abroad. This volunteer work has led to grant writing for various public health improvements in Honduras, including water well drilling equipment, water purification units, and an elevated water tank that provided water 8 hours. They were receiving water 1 hour every other day. And this elevated water tank, through a Rotary grant, provided them the opportunity to have water 8 hours every day. Obviously, we take our water consumption for granted after listening to that. These experiences of volunteer dentistry, grant writing, and organizing medical and dental brigades in Central and South America have led me to complete a Master's of Public Health and pursue an encore career in public health. HPV vaccinations were a focus of my master's program, and I wrote numerous papers about the HPV vaccine, which is the only proven vaccine to prevent cancer. With this interest in mind, my master's practicum was completed with Dr. Guy Deaton and Julie Beckman of the Office of Oral Health, ultimately leading to me succeeding Dr. Deaton as the state dental director. My practicum project was the implementation of a dental HPV vaccination program, which was adapted from a successful program in New Jersey, which you'll be hearing about a little later. Our webinar today will start with HPV vaccination background. We should move on to how dentists and other dental providers could be involved and should be involved in preventing HPV or oropharyngeal cancers. We'll describe the novel approach of the HPV dental program in 8 New Jersey federally qualified healthcare centers. You'll hear that later as FQHCs, and how to implement a similar program both in our dental clinics and also our FQHCs. We'll take a dive into how to utilize motivational interviewing into taking and talking to parents and patients about the HPV vaccination series. And we will be addressing barriers to implementing this program in your offices. The seminar will be about 75 minutes with 15 minutes at the end to ask for questions and discussion. But if you want to ask questions through the chat, do not hesitate to do that. And Ashley, just send those questions my way, please. Okay, the core objectives of this program will include raising awareness of the importance of the HPV vaccination to prevent oral cancer, teaching the dental team how to educate patients on the importance of the HPV vaccination series, as well as making sure the dental team is supported and helping to implement the program. And of course, increasing the awareness of the program that I was hoping to emulate from the New Jersey program, and the implementation in Missouri, FQHCs, and other dental offices of this program. We will also be diving into motivational interviewing and helping our patients, parents, and caregivers to understand the importance of the HPV vaccination series. Hopefully, after this webinar, it will become a routine in your day to recommend the HPV vaccination to your adolescent patients or to talk to your parents about the vaccine when they're present in the dental offices. As practicing dental professionals, do you realize that every hour, 24 hours a day, 365 days a year, someone dies of oral or oropharyngeal cancer? This year, an estimated 36,000 new cases of oral cancer will be diagnosed in the United States. Of those individuals, 43% will not survive longer than 5 years. And many of those who do survive suffer long-term problems such as severe facial disfigurement or difficulties with eating and speaking. The death rate associated with oral and oropharyngeal cancers remains particularly high because the cancers routinely are discovered late in their development. What if we, as dental professionals, could prevent a majority of these cancers with a vaccine? Let's think about this for a second. What if you, as the dental professional, can be part of preventing versus having to diagnose and give a patient the diagnosis of a cancer? This is life-changing. Here are some of the facts. 42 million Americans are currently carrying the human papilloma virus. 4 out of 5 will be infected during their lifetime, and there are 13 million new infections annually. There are more than 150 different strains of the HPV virus, but particularly HPV 16 causes 60% of the oral cancers, and 14.7% of Americans are infected with oral HPV. Unfortunately, this high prevalence of HPV will lead to a tremendous amounts of various cancers in the future, of course, including oral cancer. As dental professionals, we are familiar with the HPV, but let's review some facts about the human papilloma virus and why we want to increase the vaccination rate here in Missouri. Believe it or not, the HPV vaccination is the only one we have available that is cancer prevention. Here are some things you should know about the human papillomavirus. The virus is a very common virus. It can lead to 6+ types of cancers, such as cervical, penile, and anal, but HPV has become the leading cause of oral pharyngeal cancers. Let me repeat that, the leading cause of oral pharyngeal cancers. In fact, it's responsible for 70% of them. If you are as old as myself, which is pretty old, you were taught that HPV was the leading cause of cervical cancer, not oral pharyngeal cancers. But at this time, it has actually surpassed cervical cancer. I'm sure we all remember that HPV is spread through intimate skin-to-skin contact and is mostly asymptomatic. For the majority of people, HPV will go away on its own and not cause any medical issues. However, there is absolutely no way to tell which individuals will develop chronic health problems from HPV infection and who will not. Most people who become infected with HPV do not even know they have it, which means they can easily pass it along to others. According to the CDC, the Centers for Disease Control and Prevention, HPV is thought to, as I said before, cause 70% of oral pharyngeal cancers in the United States. So how can an HPV infection lead to cancer? Let's take a look at that. When the body's immune system cannot get rid of the HPV infection, it can linger over time and take normal cells into abnormal cells and then eventually cancer. This can take 40 to 50 years or less. About 10% of women with HPV infection on their cervix will develop long-lasting HPV infections, and that puts them at risk for cervical cancer. Similarly, when high-risk HPV lingers and infects the cells of the vulva, vagina, penis, or anus, it can cause cell cancer changes called precancer. These may eventually develop into cancer if they're not found and removed in time. These cancers are much less common than cervical cancer. Much less is known about how many people with HPV will develop cancer in these areas. The problem is there's absolutely no screening for most cancers caused by HPV. As you can see, 36,500 people are estimated to be diagnosed with a cancer caused by HPV. It can be cervical, anal, penile. Although cervical cancer is the most well-known, as we mentioned before, especially for those of us who are in dental school many, many years ago, there are obviously other types of cancer. HPV vaccination could prevent more than 90% of the cancers caused by HPV from ever even developing. So they're not even an issue if you're receiving the vaccination. This is an estimated 33,700 cases in the United States every year. Let's look at this a little differently. Take a look at this rate of cases per 100,000. Back in 1990, it has risen significantly, and this goes up to 2017. Decades ago, most oral pharyngeal cancers were caused by smoking, heavy drinking, and substance use. That's what I learned in dental school. That's the people who ended up with head and neck cancer. You were always asking about their health history of smoking and heavy drinking. HPV has become the largest contributor to oral cancer. As noted earlier, this year, an estimated 36,500 new cases of oral cancer will be diagnosed in the U.S. And many of you out there doing head and neck exams, you're going to be the ones discovering these cancers. And I would much rather have you be able to give advice on HPV vaccination versus having to tell somebody they have head and neck cancer. Actors Michael Douglas, Val Kilmer, and Megadeth lead singer Dave Mustaine have all lived with HPV-related oral and throat cancer, which has brought attention to the rising rates of this particular cancer from HPV. Let's look at vaccination rates. The vaccination rate varies state by state, from a low of 32.7 of adolescents being HPV up to date. What that means is basically they've had the entire series, either the 2 or the 3 vaccinations, and that's found in Mississippi, to a high rate of 83.2 in Rhode Island. Some states require the HPV vaccination for school entries. And of course, that's the states that have the higher rate. These states include Hawaii, Rhode Island, Virginia, and Washington, D.C. So why are we pushing for a higher HPV vaccination rate here in Missouri? Unfortunately, our Missouri vaccination rate is 59.3, which is below the national average of 61.7. But if I had my way, I would like to be up there with Rhode Island with the 83.2. And of course, at 80% is when you receive herd immunity. Missouri is ranked 35th in the country for the percentage of all adolescents aged 13 to 17 who receive the recommended doses of the HPV vaccine. So unfortunately, the Show Me State is behind the rest of the country. This is good news that we are trending up. I know that this graph is a little hard to see, but you can see we are making slow but steady progress. Obviously, that upward trend is not enough. Now, let's take a little look at vaccination rates in rural areas. HPV vaccination coverage is as much as 15% higher in cities than in rural areas. Culturally appropriate and targeted interventions are needed to address this particular gap. So when we develop patient education resources for your office or your FQHC, we need to make sure that it's culturally appropriate for your particular population. The HPV vaccination first came out on the market back in 2006. As of 2020, more than 270 million doses of the vaccine have been given worldwide, including 120 million doses here in the United States. Scientists and health organizations around the world continue to closely monitor HPV vaccination safety, and there have been no serious side effects. That's pretty incredible for a vaccination. Prevalence of the HPV vaccines infections have dramatically declined among teenage girls and young women since the introduction of the vaccine. A recent study was noted that more girls receiving the HPV vaccine, cervical cancer has dropped in young adult women. The HPV vaccine is effective prevention for 6 types of cancer, including, of course, we talked about oropharyngeal cancer. So more than 34,000 cancers can be prevented. According to the CDC, 3 HPV vaccines have been licensed: Gardasil, Gardasil 9, and Cervarix. Gardasil 9 has, since 2016, been the only HPV vaccine used in the United States. It prevents infections from 9 HPV types, including the 6 and 11, which cause 90% of genital warts. HPV types 16 and 18 are 2 high-risk HPVs that cause about 70% of the cervical cancers, and an even higher percentage of the other HPV-caused cancers. So, in other words, Gardasil 9 covers the majority of the HPV strains that cause cancer. So, we have the note: cancers caused by HPV are indeed preventable. The Centers for Disease Control recommend that all adolescents, girls and boys, should receive the 2-shot series. And if you're older, the series includes 3 shots for the best protection and immune response. Unfortunately, there are still some that do not understand the importance of vaccinating boys. 4 out of every 10 cases of cancer is caused by HPV, and every year in the US, over 14,000 men get cancers caused by HPV. And usually that is in the 40s and 50s. The Centers for Disease Control and Prevention currently recommends giving the HPV vaccine routinely to children ages 11-12, but as early as the age of 9 and through age 26. If the vaccine is given one time between 9 and 14 years, 2 doses are recommended, with each dose 6 to 12 months apart. On or after the age of 15, a 3-dose regimen is recommended, with the second dose 1 to 2 months after the first dose, and the third dose 6 months after the first dose. So in other words, when we get after the age of 15, we're trying to get those doses closer together to make sure that we complete the series. It's best to receive the vaccination in ages 9 through 12 because the immune system of a young adolescent responds better than an older adolescent and better coverage is achieved, hence why we do 3 vaccinations after the age of 15. According to the National Foundation for Infectious Diseases, younger adolescents, those through 15 years, have a 2 to 3-fold higher HPV antibody level after HPV immunizations compared to older adolescents and young adults. So in other words, we need to be talking about this vaccine earlier and starting the vaccine as early as 9. This is another way of looking at the administration of the HPV vaccine from a practitioner standpoint, but also notice in the third column, some adults aged 27 to 45 years, if they had not been adequately vaccinated in the past, the practitioners may actually recommend vaccination at that time. What about the effectiveness of the HPV vaccine? Quadrivalent type HPV infections decreased by 86% in female teens aged 14 to 19 years and 71% in women in their early 20s. Fewer teens and young adults are getting genital warts, and cervical precancers are decreasing since HPV vaccines have been used in the U.S. Decreases in vaccine type prevalence, genital warts, and cervical precancers have also been observed in other countries. Let's look at the safety. During clinical trials, before the HPV vaccine was licensed, it was certainly found to be safe and effective. They studied more than 15,000 males and females. Since late 16, as I mentioned, Gardasil 9 is the only HPV vaccine available in the US. Let's look at HPV vaccine in pregnancy. It's not recommended for pregnant women, but it shows that it does not cause problems for babies born to women who were vaccinated while pregnant, but more research is needed. What about recommending the HPV vaccine earlier? Initially, they said that it was a vaccination for 11 to 12-year-olds and up for women or for girls, young girls. And then it was expanded to boys. Now they're looking at reducing the age to 9, and there are a multitude of reasons. They found no downside to earlier initiation. The immune response is more robust at younger ages, and there's no evidence of significant waning protection after antibody levels plateau approximately 18 to 24 months after series completion. A retrospective study showed that adolescents who started the HPV vaccine series at age 9 or 10 were 22 times more likely to complete the 2-dose series by age 15. In other words, you start a little earlier. Hopefully they will continue and get both doses by age 15 than those who initiated the series at 9 or at 11 or 12. Giving the vaccination earlier offers providers more flexibility in introducing the vaccine. Finally, some providers have reported that initiating the vaccine earlier makes it easier to disentangle the HPV recommendation from the sex talk that they have with patients at 11 or 12. In addition, initiating the vaccine at age 9 or 10 also may be more preferable for parents or adolescents who do not want to receive 3 or 4, especially if we're talking the flu season, vaccines at the same time at the age of 11 or 12. Let's forget head and neck cancers for a second. A 2021 study of 1.6 million women found that HPV vaccination before age 17 reduced cervical cancer incidence by almost 90%. This study out of England concluded that if adolescent girls were vaccinated at age 12 to 13 or before, there was an 87% reduction in cervical cancers and a 97% reduction of grade 3 cervical cancers. In other words, the HPV immunization program in England, which is quite robust, has successfully almost eliminated cervical cancer in women born before September 1st, 1995. How incredible is that? Just think, if we could increase HPV vaccination rates here in the US, here in Missouri, we could not only almost eliminate cervical cancers, we could also potentially eliminate the majority of the oropharyngeal cancers caused by HPV. Just a
Dr. Miller.
reminder, the Missouri Department of Oral Health, that is my department, has a tremendous amount of patient, parent, caregiver information and flyers available at absolutely no charge. Here are some specific numbers of brochures related to HPV.
Dr. Miller,
Yes, ma'am.
we had a question come through real quick.
Yes.
What was the name of the third approved HPV vaccine other than Gardasil and Gardasil 9?
Cervarix. I can go back here real quick, but it had been approved, but we no longer use it. The only one we use here in the United States is the Gardasil 9. I think it's Ceravix possibly. Which reminds me, Ashley, I was going to ask this real quick. Will this recording be available to others in the future?
Yes, it will be posted on our website for anyone to access.
Fantastic. Okay. Any other questions?
Not at this time.
Great. Thank you. Okay. How has COVID-19 affected HPV vaccination rates? I think this headline in the Washington Post says it all. Researchers knew the vaccination numbers had fallen dramatically during the pandemic, and a 2021 study in vaccination coverage has found that vaccination coverage has dropped by about 75% in April 2020. So what they're saying is they looked at April 2019 compared to April 2020, when, of course, the pandemic hit. Nobody was going into anybody's offices, but a 75% drop in the vaccination coverage. According to the CDC, overall reduction in in-person clinic visits due to the pandemic posted tremendous challenges to the clinics in delivering HPV vaccinations. As a result, many adolescents missed out on their HPV vaccinations or portions of the series of the vaccination. Oropharyngeal cancer burden is now projected to rise among men in the United States because of this lapse in vaccination rates. Nationwide efforts to achieve the HPV vaccination goal of 80%, which we discussed as herd coverage, herd immunity as the case may be, has been a public health priority. Rapid recovery of the declined HPV vaccination uptake during the COVID-19 pandemic is also crucial to prevent future excess burden of these cancers. A study was completed evaluating psychological predictors of the intention to vaccinate with HPV and the COVID-19 vaccinations. It was found that if parents perceive a future risk of HPV-related cancers, there's a stronger intention to vaccinate. In other words, if they perceive that, gosh, this could prevent cancer in the future for my child, or wow, I knew somebody who had HPV cancer, I don't want my child to have it. The study illuminates the existing socioeconomic status disparity in vaccination rates. Parents with a less than $75,000 household income reported lower vaccination intention. In other words, they weren't planning on vaccinate due to a multitude of reasons, and some of it might be lack of provider recommendation, lack of education about the HPV vaccination. We need to be dispelling the myths or internet truths from, who knows, Dr. Google about vaccinations and educating all of our parents about the importance of the HPV vaccination and all other recommended childhood vaccinations. To summarize, HPV vaccination is safe, effective, and durable, yet uptake is obviously less than optimal. Low HPV vaccination uptake exists in areas where HPV-associated disease burden is the greatest. There is a tremendous opportunity for impact where we can encourage the HPV from our dental chairs. This is where each and every one of you in this audience can help in promoting HPV vaccination. Primary prevention of oral disease is our job. It's part of what we do in a daily practice. We educate our patients on diet, on smoking, not smoking, of course, oral hygiene, all in order to prevent cavities. We routinely screen for oral cancer. During that screening, why are we not recommending the HPV vaccine to, parents and asking if their children have been vaccinated? Or what about grandparents asking if their grandchildren have been vaccinated? Why are we not recommending it to prevent cancer? Both the American Academy of Pediatric Dentistry and the ADA, American Dental Association, recommend educating parents and patients about the relationship between HPV and oral cancer and urge dentists to use the HPV vaccine to support the use of the HPV vaccine. You may be thinking, oh yeah, that's great to recommend it, but how do I actually go about speaking to my patients about this? And how do I initiate this? And are my patients going to be receptive to this conversation about the HPV vaccine at my dental office and in my dental chair? Well, here's the good news. A 2020 study in the Journal of the American Dental Association, of course, our JADA, shows that 73% of parents feel that you, the dental provider, the dental professional, are trusted and qualified to discuss HPV. Well, who would have thought that, right? Studies have shown that, unfortunately, health professionals are not always confident in talking to their patients about HPV. Lack of access to proper information about HPV-related oropharyngeal cancers, reimbursement, and parental concerns were some of the barriers listed in this particular study. So the great news is, hey, we're trusted to talk about HPV, but how do we go about educating ourselves and incorporating this discussion into our daily workflow and our daily work schedules? One way is to start this conversation with parents during your oral cancer screening. Again, while you're completing the exam, what am I doing right now? I'm doing an oral cancer screening. And by the way, did you know that there is a vaccine that can actually prevent cancer? And is this something that you might be interested in talking about? Did you know it's available for your children, your grandchildren? And then provide information if they're receptive to your initial conversation. So what are some of the recommendations on how to bring up the subject of HPV vaccination? Capitalize on biannual patient visits. Many times a patient may not be receptive to the idea of the HPV vaccine on one appointment, but they may be more receptive after you address their hesitancy or having time to do their own research about the vaccine. Adolescent patients tend to see their dentist twice yearly, or at least we hope they do, which may be more often than they actually see their primary care provider. This is your window of opportunity for dental professionals to provide counseling to parents about the HPV vaccine and HPV's link to oral cancer. Try to include HPV cancer prevention information on your website or on your social media pages. Suggest parents visit the HPV Cancer-Free Facebook group, where members of the HPV Vaccination Roundtable can answer parents' questions, or they can follow the Twitter page. I mean, everybody's on their phone. Why not guide them to some very important information about the HPV, especially all those moms that are on Facebook? You can ask them to join certain Facebook groups. On a personal note, and this really kind of hits home to me talking about HPV, I have a female friend who was 32 years old, and she was feeling around and she felt a lump. I think it was on the right side. And she basically brought this to her healthcare professional, and the fact that she wasn't a heavy drinker, she wasn't a heavy smoker, she was only in her 30s. it was kind of, they really didn't pay a whole lot of attention to it. Thankfully, she came back and she said, no, I want this looked at. And they did some further investigation. They did a biopsy of the area. And sure enough, it was HPV related throat cancer. She had surgery and thankfully the cancer had not spread. And again, this was one of those where it was recognized at an early stage because of her wanting it checked out, because of her basically pestering the doctor saying, yeah, I want this checked out. She was advocating for herself. So they removed the cancer with surgery, and then she had to complete a series of radiation. The good news is last November, she celebrated 5 years cancer-free. So she is overwhelmingly beating the cancer odds. Unfortunately, at the time she was an adolescent, the HPV vaccine was not even available. Remember, it came on the market in 2006. So she would not have been able to take it because this was not a routine back when she was an adolescent. But with her personal story, she has actually become a huge advocate of HPV vaccination. And this is, as dentists, why we should be huge advocates of it as well. So while doing the research for one of my many papers for my master's in public health, I came across a research article published in the Oral Health and Dental Science Journal entitled Dental Interventions Improve Youth HPV Vaccination Rates to Help Prevent Oral Cancer. And of course, since this was a huge area of my interest, I was very interested in this particular article. Excuse me. This article was written by Dr. Sam Wakim, a dentist working at an FQHC, and Dr. Rena Ramirez, a physician working at the same FQHC in New Jersey. So basically, these two, the dentist and the physician, wanted to get together and discuss the vaccination rate. Between these two doctors, they worked with 8 federally FQHCs and coordinated a program entitled Project AIM, which integrated both dental and medical teams for a collaborative program to prevent oral cancers by increasing HPV vaccination rates. Their vaccination rates increased from 12% to 31.08 within 1 year of putting this program together. That is a 259% increase in their vaccination rates in these 8 FQHCs. 1 year. That's an incredible progress for vaccination. This published paper is available in the Google Drive you'll have access to at the end of this presentation. If you're interested in establishing a vaccination program in your office or FQHC, I would highly recommend that you read this article. It is an excellent source. Back to my practicum with the Missouri Department of Oral Health. This paper really inspired me. And my practicum was to emulate this New Jersey program, working with 3 clinics here in Missouri. I was working with Dr. Ben Connor, who is an amazing public health dentist here at the McCully Clinic in Washington, which is my hometown. Dr. Chris Cook at the Comtree Health Center in St. Louis, and Mac Taylor at the Southeast Missouri Health Network. So Dr. Cook and Dr. Taylor were both part of FQHCs. Dr. Connor is in a private clinic, but it is also associated with a hospital. The dental professionals were taught to utilize motivational interviewing, which I will go into a little later, and culturally competent education about the strong tie of HPV infection to head and neck cancer and the importance of the HPV vaccination series to prevent multiple cancers. If the parent and patient agreed to the vaccination series, they could be escorted to the medical offices in the FQHCs or at the McCully Clinic to begin the vaccination series, and the medical offices would follow up with the 2nd dose and the 3rd dose if needed. In other words, the medical side would keep track of those patients that were receiving the dosages, and they were in charge of reminding them about the second and third dose. The program also included laminated brochures, patient education materials, and training on implementing the program, along with training on motivational interviewing. These were all things that I developed in conjunction with the CDC and other websites, and all of this is available with this QR code that you'll see at the end. Dr. Ben Connor at the Mercy McCully Clinic reported that as of February of last year, he gave HPV education to 51 patients. 6 patients did indeed start the HPV vaccine, but 33 of them had already started the series already. Of his patients, he was able to access their Mercy records and estimates that 64.7% of them were already vaccinated prior to 2022, and this was up to 76% in 2022. He feels that the education he provided was making a positive difference in the HPV vaccination rate at the McCully Clinic here in Washington. As of last fall, Dr. Connor had educated 249 patient parents and caregivers and has documented a 4% increase in vaccination rates at his clinic in only 6 months. So the program works. He really just embraced this program and has made it part of his daily routine and along with his hygienist to ask about vaccination. They can look up either in their record or even on Show Me Vax to see if the children are vaccinated. And it's just part of their everyday routine for these kiddos to be talked and parents to talk about HPV and the vaccination.
Dr.
The
Miller.
main objective of the HPV vaccination program was to utilize dental care providers as an additional revenue and resource to spread awareness of the importance of the HPV vaccine series and the ability to prevent oral cancer. Many adolescents are visiting their dental care providers twice a year. This additional avenue for education and engagement about the HPV vaccine is absolutely crucial. In fact, I was on a Missouri Immunize Coalition call the other day, and I'm, as the state dental director, I'm advocating that dentists are a huge part of getting our vaccination rates up. So again, this is why I'm trying to get the word out. Many of the 31 Missouri FQHCs have a medical and dental component, and they can maybe start the HPV vaccination series the same day as their dental checkup. We're trying to create an urgency to vaccinate children now at the age of 9 for better vaccination immunization coverage. And if they receive the vaccine, it's better for them to receive it at an earlier time than later. We're also trying to make sure that the patients complete their series with either 2 or 3 injections.
Dr. Miller.
Yes, ma'am.
There's a question to go along with that.
Mm-hmm.
Why is the vaccination only approved for young people?
That I don't know if you saw that in the slide earlier, but they are actually encouraging the vaccine for older adults as well if they have not been vaccinated earlier. I'm trying to think of how to put this, but basically they are encouraging. In fact, I've had some adults my age that have been recently divorced, and their practitioners were recommending that they receive the vaccine I'm 55. So they are encouraging it at other ages as well, to try to, because you got to remember there's, a multitude of different HPV viruses, and yes, they are recommending it at older ages as well. The CDC has guidelines on their website, but it is recommended for older adults as well. Does that answer the question?
I think it does. Thank you.
Oh, my pleasure. Thanks for keep letting me know as those questions come through. So let's look at the process of trying to set up this program in your dental offices. Consider setting up, within your office, if it's strictly your office and not an FQHC, set up an appointment with your dental team. Or if you do have access to a physician that you can refer to get the vaccinations, set up that type of situation as well. You may not know this, but the HPV vaccine, unfortunately, this time is only able to be prescribed by a physician. As dentists, we are not allowed to prescribe this at this time. I am working, though, I can't say advocate, I'm working to educate legislators. There is a House bill out there that is trying to allow us to not only prescribe the vaccine, but also to administer it for those who might want to administer it. But it is out there. It's House Bill 249. And I really would like to educate people as to the importance of dentists being able to write a prescription for this, which would be so very nice, because we could educate our patients and then we could write a prescription and say, hey, go to your local pharmacy, go to your local public health clinic. Hey, if you're interested in this vaccine, visit your primary care. There are just many ways, but we're hoping that if we can prescribe it in the future, that would just be really another way to increase vaccination rates. Okay, that aside, if you can hopefully work with a vaccination champion, that might be your hygienist in the office, to map out a plan of action that's unique to their clinics, your clinic, and customized for the culture of your area. Basically, as a group, you want to generate ideas on how to implement the program, and a list of jobs are assigned to each member on this particular group meeting. A PowerPoint presentation, in this case where I was working with these 3 separate entities, I gave a PowerPoint presentation. It was utilized to educate the members on the concept and implementation of the program, along with another PowerPoint presentation on motivational interviewing. These PowerPoints will be available again at the end of this presentation in a shared Google Drive. So, by the way, make sure to have your phones out so you can take a picture of the QR code, and that will be available at the end. And again, there will be a copy of this available as well. The critical point is that the entire office must understand the importance of the HPV vaccine. And we really need an all-in, everybody is into this, and that they're all together about educating their patients about the link between oral cancer and HPV. In particular, we were in the computers, we actually had the IT people flag the patients between 9 and 18. So they basically put together a little program that would flag the patients that were coming through on that day between 9 and 18, and then having the vaccination champion, either the doctor or the hygienist, communicating with the patient's parents and caregivers of this particular age group. But again, as it was mentioned, it could be older too. Hey, have you looked into this vaccine? Is this something that your physician would recommend? So collaboration with the medical team to track the vaccinations and to follow up on completion of the series. Before implementation of the program, the designated vaccination champion was tasked with gathering initial statistics of the vaccination rates for this particular medical or dental clinic. Again, we started with having the IT develop a program to identify these patients. Then we looked at the Missouri program's Show Me Vax, or their whatever their record might be, their Compass record or in Mercy record, to check on their vaccination status. In other words, their electronic health record. By the way, the question came in a past webinar asking about Show Me Vax. Can we look at that? Are there HIPAA policies? Show Me Vax does not violate HIPAA. As physicians and dental professionals, we are authorized to look at immunization histories on this platform. My screen went black just for a second. There we go. Those who have not started or completed the HPV vaccine were flagged by the computer for motivational interviewing about the HPV vaccine by the vaccination champion, whoever that might be, the doctor or the hygienist or both. We also added a drop-down option for all the records of these patients asking about their vaccination status as a reminder to ask about the status for the dental team. Those who have not started or completed the HPV vaccine, and notice I said not completed, because even though they may have gotten one injection to complete the series, you may want to ask, hey, it looks like you went ahead and got a HPV, got the vaccination series started 6 months ago. Did you finish that up? So, we want to make sure that they complete the entire series. Then if they had not started or completed the vaccine series, they were flagged for motivational interviewing, which is a patient-centered method to provide a collaborative approach to behavior change. We'll talk about this a little more. It's basically where you're talking to your patients, not in a authoritative, hey, this vaccine's been proven, it's safe, you need to get the vaccine. It's more in a collaborative, supportive approach where we're asking to motivate them towards a behavior change in a safe, non-judgmental, and supportive environment. Patients and parents can take control of their behaviors and are therefore more likely to succeed in any subsequent behavior change. Motivational interviewing is a useful method to promote behavior change, and it can be successful in a variety of patient settings, things that we would like to change, such as smoking cessation or different eating habits, or talking about not snacking in between meals. But in, of course, of our case, we're using it to encourage the acceptance of the HPV vaccination. Again, it can help people adhere to better oral hygiene practices. This approach, this motivational interviewing approach, which we'll really dive into a little deeper, helps patients accept responsibility for their health and encourages autonomy in their decision-making. The goal is to evoke a positive behavioral change from within to improve health. A patient-centered approach is more likely to result in a patient actually taking positive actions towards behavior changes. This may mean that the clinician, rather than telling the patient what to do, simply guides them. Dental care providers are, using this, or hopefully they're using this on a daily basis to support them towards achievable changes. Many times the dental professional may encounter vaccine hesitancy. Back in, according to a 2022 research article that's listed here, some may be hesitant, somewhat hesitant or unsure. Depending on their level of hesitancy, sometimes their reasons for lack of vaccination intent had to do with safety, side effects, lack of necessity, reporting that the adolescent is already up to date, even though they may not be. I know this may be a shock, but sometimes parents may not always give you the entire story. They may report that the adolescent is already up to date, as I said, reporting that they are not sexually active. Why should they need this if they're not sexually active? So there's a multitude of reasons, but this is a really good study because it allows you to kind of gauge where are they in their hesitancy level. And just to make sure I'm correct, the bivalent vaccine that was offered many, many years ago that somebody had asked, it's CERVARIX. So I probably spelled that incorrectly. I'm a terrible speller. But anyway, that was one of the vaccines, but it was just a bivalent. So it was only taking into account 2 of the variations in the HPV versus 9 that Gardasil now takes care of. So basically, you need to try to find out where are they in their journey to accept this vaccination. But I can tell you that a strong recommendation from the dental provider is one of the best ways that you can recommend it, because there are plenty of studies that said without a strong recommendation, there are far few vaccinations that occur. Let's see, and then you can also look at the concern for cost. I've got a slide a little later that talks about that. In addition, education about the HPV vaccine should be tailored, as we said, specifically for diverse populations because of historical trauma associated with vaccinations among minority populations. It might be helpful to engage with other trusted community resources to achieve this shared goal for your community. Let's talk a little bit about the historical trauma and vaccine hesitancy. Certain populations are very hesitant about vaccinations and certainly have reasons to be suspicious. You know, you can take, for example, the Tuscany syphilis study, which was conducted between 1932 and 1972, in which a group of nearly 400 African Americans with syphilis were never treated. They wanted to observe the effects of the disease when untreated. They were never treated with penicillin, even though at that time we knew that was a treatment standard. As a result, the study went on for 30 years without treating patients. They had more than 100 patients die as a result. So unfortunately, Black, Indigenous, and people of color with a high prevalence of HPV infection and also a high incidence of HPV-associated cancers don't receive the vaccine because of some of these issues. Even though there's an effective HPV vaccination program in almost all developed countries to prevent the incidence of cervical cancer, reports suggest that the uptake of these vaccinations by Indigenous and other communities are low. So we basically really need to make sure that when we have these populations that we work very, very hard to increase these vaccination rates. Some may say, well, gosh, you know, I don't have access to the vaccine. Well, you can look at your county health department, your pediatrician, your primary health care. There's free programs through the free vaccines, the Vaccines for Children's program. There's lots of information out for parents, and a lot of insurance most insurance plans cover the vaccine. Specifically for your kiddos that might be Medicaid eligible, if they are younger than 19 years old, if they have no insurance, the Vaccines for Children can cover it, as well as American Indian and Alaska Native. Okay, so what's your message about HPV? As the dental professional, you again are supposed to give please give a strong HPV vaccine recommendation. As I told you, there are studies that say that provider recommendations, if you have only 47% are vaccinated without a recommendation, but 75% are vaccinated with the recommendation. So you need to look at how are you in your office going to answer some of these questions. You know, what is your message? Why are you recommending the vaccine? I would recommend that you have answers just typed out and printed that everybody in your office can give the exact same answer when it comes to these questions. You can download educational materials. You can laminate these. You can put them out in your waiting room, your operatory, your reception areas, wherever, anywhere that you can try to educate. Make sure your clinic's all on the same page. So these, again, a lot of these answers are available, you know, that all of you are on the same page. Why does my child need the vaccine? Would you get a vaccine for your kids? Make sure you have these answers ready to go. And here is just another resource. The CDC has some great resources on answering questions about HPV. You want to collaborate with the medical team if that is indeed available. And even if it's your, you know, if you have a pediatrician that's living or that has a office near you, make sure to work with him or her and see if there's the opportunity to send patients their way for this particular vaccine. Okay, before I get into motivational interviewing, which looks like I'm only going to spend about maybe 15 minutes on it, are there any questions on HPV, how to answer questions, anything so far? And I'm thankful I got the spelling for that bivalent vaccination. Anything at all? Is there anything in the chat?
There's nothing more that's come in yet, Dr. Miller.
Okay. All right. So let's talk a little bit about the provider communication sheets. Number one, make a strong provider recommendation. They're going to say yes or no. If they say yes, then send them to get their vaccination. Oh, I'm really glad you decided this is what you want to do. Where's the best place you can get your vaccination? Okay, what if they say no? Then this is where you implement your MI skills, your motivational interviewing skills, approach, techniques, framework, which we'll all go through. There are 4 integrated components that foster communication and incorporate the spirit of MI. These include partnership, acceptance, compassion, and invocation. Partnership encourages communication with a person as a partner to collaborate in order to reach a goal such as vaccination. MI is done for and with, not to and on. During this partnership, the patient and the clinician develop rapport, and when appropriate, the practitioner asks permission to discuss potential behavior changes. Asking permission lets the clinician know that the individual is willing to enter into a discussion. Complementary to partnership is acceptance of the patient's autonomy. Acceptance is understanding the patient's perspective and not being judgmental, ensuring that we focus on their positive health behaviors and supporting them with their self-efficacy to change. You need to develop skillful reflective listening as well. Compassion involves a deliberate commitment to actively promote the patient or the parent or caretaker's welfare, to give priority to their needs, not yours. The evocation component is an attempt to explore what's important to the patient and how they would like to make the change. Evoke and strengthen what's already present, not install what is missing. So when talking with a patient or parent about HPV vaccination, you're asking for permission to approach the subject. You're drawing out what is important to the parent, patient, and wanting to vaccinate, and you verbally give priority to their needs and concerns before helping to guide them to potential change. So we talked about developing the skill of reflective listening when working on acceptance of the patient's perspective. What is reflective listening? Basically, reflective listening invites more dialogue. You reflect content and feeling, and you reflect back what you think the meaning may be, and then you clarify. So you mean, or is this what I'm hearing? To make sure you're understanding their point of view. Reflective listening involves repeating or rephrasing the person's comments in a way that demonstrates your understanding and validation of them. For example, what I hear you're saying is you think your child is too young for sex, and therefore it's too early to get them vaccinated for HPV. This technique builds empathy and allows the provider to confirm they understand the reasons behind the parent's hesitancy before moving forward with the conversation. Let's talk a little bit about how to utilize MI in encouraging HPV vaccination to prevent oral cancer. Step 1, you want to engage the parent or patient. You need to work to establish mutual trust and respect via acceptance and compassion. Work to engage the parent or patient in a general conversation. Next, you want to present HPV as a topic of conversation or a shared agenda. For example, I noticed your child has not undertaken the HPV vaccination series. Can we talk about the HPV vaccine? The next step is to evoke or draw out motivation via change talk if the parent wants to talk about this vaccination. Move on to a planning stage. In other words, where can you go to become vaccinated, or what steps are necessary? If the patient or parent's not ready to talk, then ask their permission if you can talk about the vaccination at their 6-month checkup, and then put that in the record. What do we mean with the terms change talk? Remember that MI is a therapy style that utilizes empathetic, non-confrontational approaches to help people make their own realizations for their need to change. So change talk is the mentioning of a person's desire, ability, reason, and need to change their behavior. The belief is that a person is more likely to change and stick with the change if they personally invest in their plan to make a positive change, such as vaccinations, such as quit smoking, such as losing weight. So when you engage in MI, you have to pay attention to their language. Is there change talk? You want to hear things such as I wish, or I want to, or I can. You want to look at for my child's health, or using statements including need. These are all ways that you're listening for change talk, and then you know that they are willing to continue the conversation. A little bit about discord. How do you identify it? There's multiple ways. You can listen for arguing. Are they challenging? Are they hostile, as in, I don't want to talk about vaccines? Well, then fine. Okay, then we're not going to talk about it, and you move on. Are they talking over you? Are they ignoring you? Are they looking at their watch? Are they looking at their phone? Is there no answer, no response? Are they trying to sidetrack the conversation? Are they interrupting you, trying to talk over you? Are they negating by blaming or denying? My husband was supposed to take care of that. You need to work to get the discussion back on track and reestablish that connection. My favorite is the pseudo-complying. This is where they're agreeing to make you happy, but no positive changes will occur. I'm pretty sure if you're a parent, you have heard this with some of your teenagers. Many times with my 5, it was, yeah, mom, whatever, and that is pseudo-complying. We're saying they'll do it, but they don't. Once you have permission to talk about the HPV vaccination, you may want to use an additional technique, elicit, provide, elicit. You want to ask the parent or caregiver for what they know about the HPV vaccine, or would they like to know more? So that's eliciting. You may want to understand that the parent already knows, and if there might be misconceptions or misinformation. If they're open to the dental provider providing more information, make sure to ask for permission. Provide if they give you permission. Don't use I or you. Make sure that it's given in a neutral and broad-minded way. Match the information to fill in the gaps, or maybe the misinformation in their knowledge that they may have gained from the internet. Who knows? But don't argue with their beliefs. Reflect that their reasons reflect back to them, and then finally elicit, gather their understanding from the feedback that you provided. This communication technique demonstrates respect for the person and is less likely to create interpersonal discord. So let's review MI. Start with partnership language, establish a relationship with the patient, ask for permission to discuss, affirm your strong recommendation, and reflect on the conversation to make sure you're understanding their concerns that may cause hesitancy in receiving the vaccine. And then you want to elicit, provide, elicit, utilize empathy as you understand their concerns, and empower the parent or the caregiver that they're able to make their own decisions about the change. Make sure you emphasize their autonomy. Make sure they understand they have control and choice over their own lives. Evoke reasons and needs. Listen for and resolve any discord between working to guide them towards the final goal of change. Okay, I just wanted to put this up here again. It's in the QR code. It's a great example on the web of motivational interviewing for HPV vaccination. It's on YouTube. Now that we have a pretty good handle on motivational interviewing, let's move on to addressing barriers and challenges in implementing this program in your dental clinics or your dental offices. So when I was speaking to the directors of the 3 clinics after delivering all of this information, they were all on board. They had all watched the motivational interviewing. They had all watched the programs that I had provided, but several barriers came to light. One of the biggest barrier was, of course, as we all need more time in the day. The challenges came with the extra step and the extra time involved in looking at patients on Show Me Vax or their electronic health records to see if they had been vaccinated, and incorporating this extra 10 minutes into their day. It was very, very difficult just to get into the routine of doing this on a daily basis. But there are some clinics that are doing this on a daily basis, and they're the ones that their vaccine rates are increasing. So that was in certain parts of the state, especially, in certain parts of the state, there's a lot of vaccine pushback, especially after COVID-19, in some of these more conservative areas. And it's not just the COVID vaccine that's been pushed back on, it's all of these childhood vaccines. And they've even become politically charged. And even some of the vaccinations that were accepted normally are now being brought into question. Another barrier that came up was the approval of the HPV program through the chain of command, especially in FQHCs. They're just trying to get a time to meet with the medical director, getting this program approved by the higher ups. Coordinating and communicating was definitely a barrier that some of my practitioners had to deal with. There were staffing changes where you had to educate all new staff members about positive culture and encouraging the HPV vaccine. So there are a lot of barriers and challenges that come with any change in the office. But what they found with the program in New Jersey, with time, persistent monthly meetings, changing how they were doing certain processes, workflows, they were able to make these modifications and make a tremendous increase when it came to vaccination, which has the positive outcome of decreased cancers in the future. Let's see, we are at 1:12. So I'm going to go through these next couple of slides fairly quickly. We looked at next steps, provide education and training, communicate with families, set up follow-up reminders, and continuous check-ins and reevaluations to see how they can better the program, either within your office or within your FQHC. We looked at evaluation. Basically, your biggest evaluation was feedback. How can we make this program better? Allowing to look at successes and failures, and then putting together best practices. I'd really like you guys to take a look at this cancer prevention through HPV vaccination. It is a amazing, it's actually available through the ADA website, through the CDC website, but it's an actual action guide for dental providers that provides a great way to be an advocate for the HPV vaccine. This is a little outline, know your rule. Practice prevention, talk about the preventive aspects of the HPV vaccine, refer patients for their vaccination, engage with your team to create a culture of cancer prevention, and collaborate with your local primary care and pediatricians to make sure these patients are getting their vaccinations. In conclusion, 90% of HPV cancers are preventable with the HPV vaccine. You, dental practitioner, dental assistant, dental hygienist, dental front office, you are the key to cancer prevention. Become informed and prepared. And number 4, huge, collaborate within your own team and within teams integrated between dental and medical professionals together. Here's some of the references that I utilized, and here is that glorious QR code that was created. And if you guys would like to take a picture of it, there is a ton of information that I have put out on I said me, it was actually my daughter put together the Google area so that there's all of this information and more is all out there for you. So there is my phone number. That's my personal cell number. There is my new email as your state dental director, and the shared Google Drive. So We have about 15 minutes left, 16 to be exact. So I'd like to open it up for questions and discussion. What questions do you have? And then if there's no questions, I might put out, or not put out there, if there's no questions, or even after questions, we may want to discuss what you would foresee as being a barrier to you implementing this process in your office. So I am going to discontinue my slides, and I'm going to stop sharing. And okay. Oh, there's that little sweet pea. I love your son, Ashley. He's so cute.
Oh, thank you. He just woke up. And we haven't had any questions come in yet. I'm just going to remind everybody that you can submit those either through the Q&A or through the chat. So we'll give them a second to think of some questions, Dr. Miller. I just wanted to thank you for that presentation. You did a fabulous job highlighting HPV and how it manifests in the oral cavity and what dental practitioners can do to encourage vaccination. So thank you for that presentation.
My pleasure.
We're just waiting to see if we have any questions coming in. Gary, do you have a question for Dr. Miller by chance? You're muted still. Gary, you're still muted.
I do not have a question, but I want to encourage others who are on here to ask questions. A lot of smart people on here. John Dane probably has a question, and I think probably Maren Linhart has a question.
We've got lots of feedback of great presentation coming in, Dr. Miller.
Thank you so much. My pleasure. Okay, so if there aren't any questions, then do any of the, okay, there is a question. Do you know of any of the dental schools are teaching HPV vaccinations? Absolutely. I was up at UMKC a couple of weeks ago, and I've talked to their public health program as well. And yes, they are teaching about the HPV vaccinations. To my knowledge, that's pretty routine. I'm sure MOSDO is, and I have no doubt KCU will have that part of their program. If not, I will definitely be asking. I've been very blessed to have people in both of those, in all three schools that I can contact, but to my knowledge, they are teaching that because I have asked and reached out about that, which is incredibly important. And hopefully, if we are able to eventually have the opportunity to prescribe the HPV vaccine, that would just be a very good piece of the puzzle to increase our vaccination rates. Does anybody out there, perceive any, other than the time frame in looking up whether somebody's been vaccinated? What kind of barriers do you see in your office that might precede being able to implement this program into your practice? What barriers do you perceive making this part of your daily practice, recommending the HPV vaccine? Okay, very good. Maren said too controversial. That's where, even though wonderful, thank you. I completely agree. That's why we really would like to, it's unfortunate because when this vaccine came out in 2006, they really tied it into sexual activity. And I wish it had been rolled out in a different fashion. If it had been rolled out as a cancer preventative, I think we would be in a much better situation than we are now at this time. If we really stress the cancer prevention, that is, in my opinion, one of the key factors to get this vaccination out there. John Dane says resistance from other healthcare providers, physician, pharmacists, and nurses in providing the vaccination, or in whether or not the vaccination, and I don't know if we can unmute people, but Dr. Dane, we're in providing the vaccinations. Yeah, and that's unfortunate. But again, this HR 249 does talk about dentists providing the vaccination as well. So providing and prescribing and providing. So, and so much of this is education. Dr. Deaton and Dr. Dane both said that the majority of my job is education. And when it comes to HPV, it is education. But I know it sounds weird to be excited about a vaccine, but this is the only vaccine that prevents cancer. Nothing else out there is a vaccination that prevents cancer. So that's why I want to shout it from the rooftops, because we don't have anything else. We're just so far on so many things when it comes to healthcare, and so many amazing things that have been done in healthcare, but this is the only vaccine that can prevent cancer. It's just incredible to me.
Stepping out from education a little bit, the coalition can advocate, and we do. And in fact, we support House Bill 249. And if that kind of legislation or that particular legislation is going to pass, it's going to take individuals to approach their elected officials and say that they support it. There is always resistance to this type of change. And in fact, there is some now, but it's a reasonable, sensible thing to do, and it should be passed. So get out there and advocate for this. Talking to a legislator is just like talking to your neighbor. You want to get along with them, but you need to, discuss business. Plus, they expect you to ask for something. So they're not surprised when you say support HB 249.
Lauren has a very good, and yes, I'm glad you brought that up. We have pediatricians who say he sandwiches the HPV vaccine in between the others. Yes, that is definitely a recommendation from the CDC and the pediatricians. They just make it part of their, when they do the 11-12 vaccination series, they put it right in the center, and then it's not drawn out as something separate. So they make it part of their normal vaccine recommendation as part of a normal vaccine that they would recommend to any other 11 or 12-year-olds. So yes, that is a huge help. So thank you for bringing that up, Maren. And unfortunately, yeah, you're right. We can't necessarily do that in a dental setting. I mean, there's no reason why we couldn't say this is a cancer preventative. It should be part of your normal vaccination series. Absolutely no reason we can't throw that in there. Anything else? Okay, then Gary, and Ashley, unless you have something else, we can give everybody 8 more minutes back to their day.
Thank you again, Dr. Miller. I just wanted to take a second and remind everyone that you will be getting an email with a survey link for the evaluation that will need to be completed in order to obtain your continuing education credits. We did record today's webinar, and that recording will be available on our website at a later time. And we have a couple of more pre-conference webinars coming up in the coming weeks. One on meeting with your legislators, and one around, Gary, remind me what the other one was from. Was it sealants?
Yes, that is correct. And you can find that information on our website, and drop us a line if you need more information. We'll be glad to provide it for you. I think most people on here are probably getting our emails, but info@oralhealthmissouri.org is the generic email address. You can email us. We'll add you to our list.
And one final reminder, conference is coming up March 2nd and 3rd in Jeff City, and registration is open and available. That is also on our website. Yes, Dr. Miller.
One final thing, just as state dental director, Gary made some very good points, and I am providing information about this particular bill. I'm not advocating, but definitely, as Gary said, on a personal basis, others can advocate for this particular bill. So just wanted to clarify that a little bit.
If we have no further questions, thank you again, Dr. Miller, and we look forward to seeing you all at our next webinar.
Thank you, everyone.
Thank you.